somewhere around 80% of my appointment is clinically oriented, but during that time I engage with medical students and residents. My specialty is musculoskeletal radiology, and I do that pretty much 90% of my time, and a little bit of general radiology in the emergency room for the other 10%. But my primary focus is bone pathology, muscle pathology, and a lot of the new exciting things that are envelop that particular area of medicine. Well, I've been very fortunate to be part of the case series for Elsevier. It's the imaging branch of the requisite series, which are two very hugely popular product lines, and I was actually very excited because I was initially had a concept of doing a book that was very similar, and I was trying to forge that on my own. And David Usum, the editor for the series, called Donald Resnick, who's really one of the biggest names in the bone field, and he said he asked him for a recommendation, and he recommended me for doing the case series for musculoskeletal imaging. And of course, when David called me, I just jumped at the opportunity because I was already heading towards that kind of endeavor, and really fit the style, really fit my method of teaching. It's a little bit interactive. So we wrote the first book in 2002, and then the second edition came out around 2007. And now we're really excited because we've converted the latest editions for each segment of this series into an online version that we're launching at this year's RSNA. The kids today, I think the young radiologists that are preparing for the board examination really are very technology savvy. They have really embraced the social media, and I think that they have really fed their education by whatever tools are available through the internet. And the internet also has allowed interactive type of engagement where, parochially in previous methods, when we had to try to converse with them through a written media like a book, it was always a one-way, it's a one-way talk. And this allows the resident or the person who is preparing for the board examination to ask queries and get immediate feedback. So the niche that it really fills is for that person that is preparing for the board examination, but it does serve a more general purpose as well. I mean, everyone needs to refreshen their skills and to know what the latest information is out there. So, and I surmise that almost every state is going to require some type of recertification. Even those of us that are grandfathered for the American Board of Radiology won't be able to escape that at the state level. And I think that it's going to serve a very useful role for those people that are going to be preparing for some type of standardized examination. Working with the book was very easy. I mean, they offered a template method, which is, if you just look at the types of lectures that I give at the national level, I'm always preaching a template approach, and a checklist approach is always the thing that keeps you honest. It brings up the rear, makes sure that you remember the things that you're supposed to do that's always may not be in the forefront. I think Elsevier did that with the book. It really kind of inspired me to make sure that I was always closing the loop and making sure that everything was comprehensive. Personalized medicine is something that is so huge, and everyone is trying to come to grips with what that's going to mean in their own practice, but also more globally at the institutional and at the national level. I think universal healthcare is going to propel that faster than many of us were perhaps ready to embrace. But I think that's a good thing. I think sometimes you need a good strong push in the back to really get things going. But personalized medicine is something that we all have to adopt and embrace. We need to look at films as individual patients and how we can best provide optimal patient care at the cheapest, most accurate way